Our laws as it pertains to substances are draconian and bizarre. The psychopaths start this way. He was an alcoholic because of social media and pornography, PTSD, love addiction, fentanyl and heroin. Ridiculous. I'm a doctor, for sake. Where the hell do you think I learned that? I'm just saying, you go to treatment before you kill people. I am a clinician. I observe things about these chemicals. Let's just deal with what's real. We used to get these calls on Loveline all the time. Educate adolescents and to prevent and to treat. If you have trouble you can't stop and you want help stop it, I can help. I got a lot to say. I got a lot more to say.
Hey, everybody. Welcome to Ask Dr. Drew. We are going to have a special guest in just a moment. We have our friend Nicole Angemi coming on in here. I am checking you guys out here on the Restream. What's up, everybody? Looks like only YouTube is ringing in. A little bit of Twitch here and there. I don't see Facebook or whatever happened to Periscope. Careful, Tom Cigar is loose in the group here, so it could get rough tonight. Thank you guys for coming in. We appreciate it. We're going to go down a little bit of a different path today. Nicole is renowned for her pathology reviews. She has website, Instagram, Mrs._Angemi, and she's been canceled on Instagram more times than I can count because, well, her pictures are very colorful. And so when we get to these pictures, which are to Nicole and I just axiomatic sort of medical pathology, but to some, like Susan Pinsky, they are evocative. And so she wanted me to be sure to point out to people they should keep, maybe not be eating and get out of the room when it gets...
Explain what evocative means.
Intense. They could be, you could throw up. You might throw up. This nearly happened to Susan a few minutes ago.
If you don't like needles, it might make...
If you don't like blood, don't like needles, don't like pus, this, we're sort of, you're in that zone with all this. Nicole, her new website is theduramater.com for the dura mater in your brain, the heavy coating, the heavy shell that's over your brain, Duramater. Nicole's a pathology assistant who has 1.9 million followers on which she takes along in the behind-the-scenes looks at autopsies and infections, motorcycle accidents, all kinds of things. Let's get Nicole in here. Nicole, one of my favorite guests, thank you for joining me. Good to see you.
Hi. How you doing?
We are good. We had a little technical problems. There might be some glitches going here with the sound, so we'll please everyone be patient with us. So Nicole, I was hoping, it's been a while since I've had you on one of my programs. I was hoping you'd tell your story about how you got into pathology, the whole story with the legs in the refrigerator and all that business that got you into this work.
You really love that story, don't you?
I do. It's very dramatic.
So my undergrad degree is as a cytotechnologist, which is looking at cells under the microscope, like pap smears and stuff. And I was working in the hospital one day, just sitting in my little cubicle looking at cells under the microscope. And I heard everybody in the hallway making a commotion that there was like this really bad smell and what's happening and stuff. And I went out there to check what was going on, and they said that the leg refrigerator was broke and it was leaking everywhere. So I was working in cytology, so I didn't really have any idea what was going on in the room next to me. But I was like, what do you mean the leg refrigerator? So of course to look and see what was going on. And there was a fridge like you would see in a pizza shop or something that has soda or something in it. And it just was stacked up with amputated legs, like wrapped in biohazard bags. And it did smell really, really bad. It was decomposed meat smell. But I just thought it was so cool that that kind of stuff was going on in a room, like right behind where I was sitting. And then I started going over to that lab all the time to see what was happening. And I saw, amputated limbs and giant ovaries coming down from the operating room and people's colons and placentas. And I used to go every day for fun. And then I was like, okay, I need to work over here now.
I'm writing down the list of pathology specimens that impressed you. Giant ovaries, placentas, and limbs. which are some of the more common things that are coming out of people on a daily basis in a hospital, right? I mean, as you said, colon resections, small bowel resections, and placentas aplenty, and ovarian tumors of all types. So ovaries are removed very commonly. So that makes perfect sense to me. All the limbs never made that much sense to me. Was there something about that facility that they specialized in sarcomas or something?
No, it's for gangrene for diabetes. We get them all the time.
Got it.
It's any when at the time I was working at a trauma center, so we used to get legs from train accidents, motorcycle accidents, things like that. But for the most part, it's usually for gangrene.
And so what kind of training did you have to go back into to get on the gross pathology side?
So I had to go back to school to get my master's degree as a pathologist assistant. So I went to Drexel because I was already working in Philly and it was kind of right up the street. So it all worked out well. It was an additional 2 years of school after my undergrad degree.
And then you started essentially doing the autopsies, or at least doing it under the supervision of a pathologist, correct?
Yeah, I started doing, like, working over there before I graduated from PA school, and then I started doing the autopsies myself there. So I would basically do the whole evisceration part of the autopsy, and then the pathologist will come down to the morgue. You know, if I find something cool or whatever, I would call them down and say, hey, can you come look at this? And I always called them down to look at it before I would sew the body up. But yeah, I was the one that took all the organs out and everything.
Now, do you have to I mean, I'm imagining there's got to be some look at the nerves and the arteries and the veins as you're going through the anatomy. Did you have to do careful gross anatomy before you started doing pathology?
Yeah, when I was in PA school, we had to take gross anatomy for a couple months, just like you would in medical school. So we had to learn, you know, we had a cadaver for I think 3 or 4 months that we dissected every single day and just went through, you know, we started on the skin of the back and just kind of like worked our way inside the body. So yeah I learned a lot of that.
So what kinds of stuff, what impresses you when you open somebody up? What kind of stuff do you find exciting?
Well, I feel like I'm not like most people.
We got that part already, Nicole. That part's already established. So keep going.
Well, it seems like so many people they're so interested in crime and murder and things like that, and I'm more interested in natural disease and pathology. I just get really excited if I see anything that is naturally occurring that's cool or rare, or an anatomic variation, like things like that just get me like really excited.
And are you getting into the opening the skull too, or does the pathologist do that?
Oh no, I do that too.
Explain to people what goes on with that. That's kind of an interesting piece of the autopsy.
Okay, so for the most part, we do the incision the same on everyone. So you just go from ear to ear, and I usually get a comb and part the hair so I don't cut the hair when I make the incision. So I kind of use my skills of being an ex-hairdresser kind of to make a part. And then I get the scalpel blade and make an incision from behind the ear across. It's kind of like the crown. And then I have to peel down the skin on the forehead and on the back in order to expose the skull, because we have a special oscillating bone saw and it only cuts bone. So it doesn't cut through soft tissue. So you really have to expose the whole entire bone before you're able to use the saw. So I always tell people when we have to peel the skin off of the skull, it sounds like when you peel like an orange kind of. That's the same as that, because you're kind of ripping the skin from the fascia of the bone, and it's kind of like orange fascia stuff.
Well, you're having to use you have to dig your fingers in the way you would your thumbs in an orange as you're peeling it, right?
You kind of have to like blunt dissect it with your, you know, you don't use a knife, you just use your hands, and just it peels right off. But
and then you do the saw around the cranium, the calvaria, right?
Then we remove it, and then we take the brain out after we take the bone off.
How far down do you go? Are you trying to get all the way to the brainstem, or is there sort of I always wonder if there's a convention to that.
Yeah, we take, I have these special curved scissors that you could kind of stick really far down into the spinal column and cut off. There's usually a little nub of spinal cord. Mm-hmm. And then if a pathologist wants to examine the whole entire spinal cord, then, or a portion of it, we could either take out a portion of it or take out the whole thing.
And the whole thing, do you have to dissect through the vertebral bodies, or do you do it from the top You pull it from the top.
So I prefer to do it from inside. Well, it depends. If we're doing an autopsy, so I've done autopsies on patients with ALS because like we collected the brain and spinal cord for research.
Yeah.
So they don't really care about any of the internal organs at all. So we would like take the brain out and then flip the body over from the back and then take it out. But that's much harder to do that way. So, but on a standard autopsy, after you take out all the organs, like all you're basically left with is the shell of the vertebral column and the ribs. So you can just kind of cut along the discs and take the spinal cord out really easily that way.
I'm looking at some of the questions on the chat stream here, and Carol wants to know: do you watch Dr. G on TV?
Yeah, I love that show. I used to watch it all the time, and I think it's one of the most accurate to what the job is really like.
The one that bothers me is the pathologist that is diagnosing from his armchair based on path specimens on celebrity deaths. That's in like, it's on like, not Stars. It's on
the Real.
Reels, on Reels. And he's so far, he seems like a very smart guy, he seems like a great pathologist, but he's so far off clinically because he's making pronouncements about mental health and addiction and things that are just way, way, way off. And it drives me a little crazy.
Most shows do drive me crazy.
Yes. Likewise. I can't watch most of them. Okay. The thing that drives me the craziest of all is every show that involves a surgery or an emergency room. Every scene is give me the if doctors and nurses were like that all day, oh my God, we would last about 7 hours and we would have a coronary. We'd have a heart attack.
Twitter version.
It's like, you know how it is. Give me the usual IV fluids. You know what to get. Go ahead. Yep. Hang it. Go ahead. Yep. Give me a chest tube. Let's go. You know, it's routine. If it's not routine, if you haven't done it a million times, you shouldn't be doing it. So
yeah, exactly.
Oh
I think
my
my
God.
husband could speak about the like firefighter shows and stuff. He's, you know what I mean? It's like everything is just overly dramatic to pull people in, but then it gives people an unrealistic expectation of what the job really, you know.
If you run into a fireman who is upset, that's not where you want to. You want him or her to be
Or
routine.
sleeping with one of his colleagues.
You want them to be on a routine management of the fire. You don't want them to be scared, upset, freaking out. You don't want any of that, believe me. So, same thing with the physicians. All right, so hang on a second. I'm looking at some of the questions on the screen here. Give me a second.
Chris wanted to know if she had an opinion about the Epstein.
Oh, that's an interesting question. I had not thought of that. The Epstein conclusions about him having hung himself or not. Did you have any opinion about that?
Yeah, I mean, I think that it looks a little suspicious. I don't like to get involved with things like that too much, but I don't think it is as it seems, I would say.
Sandy Finn is asking, have you visited the body farm? I've actually, Sandy, interviewed the professor that runs the body farm. Do you know what that is, Nicole?
Yeah, I really would love to go there one day, but I've never been there.
For those of you that don't know what we're talking about, is they literally take bodies and bury them and study them at different stages of decay from like 10 minutes to 10 years. And it's a science. It's a science. It's you know, it's something that would attract Nicole and disgust Mrs. Pinsky, but it is a science.
Yeah, not my gig.
Not your thing. But Nicole would like to introduce Mrs. Pinsky to her because that's so much fun, see her react.
As long as I have a martini, I'm okay.
Oh, they don't bury them. I guess they don't bury them. I thought they did bury some of them. Did they not bury some of them, Nicole?
No, I think that they put them in all different, because decomposition is based on in different environments, you know, if it's cold, if they're in water, if they're not, if they're exposed to, you know, animals, if they're not, like things. I think they put them in all different sorts of circumstances. Yeah,
that's right. That's what the guy was telling me. He's quite a bit older now, and I forget the whole story. I interviewed him for a long time, and he told me the whole story about how it got started, and it was sort of serendipity meets you got to be kidding me, and he wanted to do it, and he needed to come up with some answers on something, and it became this, it's really a national treasure in a weird way, right?
Yeah, I want it. Can anybody just go can go there.
I think it's attached to a school, so I don't know. You can't. I'm sure you can't just walk around there, but I'm certain you could arrange a visit. I'm certain.
Tom Cigar says it's just bodies in a swamp.
Essentially,
The one in Florida.
Oh, there's one. This
My
guy,
husband, I told him that is where we were going on vacation.
and so the honeymoon.
Do they have the honeymoon suite?
We're gonna have our anniversary at the Body Farm, honey. And it's not a spa. All right? I'm sorry, but it's not. It's in like Alabama or something, isn't it?
Well, Tom says there's one in Florida.
I'm not sure. There might be a couple of them. I'm really not sure, but I could just kind of plan it around it and just stop there for a day.
It's called the Forensic Anthropology Center. That's the actual name for it. And it's University of Tennessee at Knoxville, Tennessee.
Oh, yeah.
Yeah. And 20 years of training. They've got a great website, research you can do, Nicole. We do not provide tours of the Body Farm.
I don't
Sorry,
know what
Nicole.
Tom Cigars is talking about. Maybe that's just some Floridian with a bunch of dead people.
Maybe that's just Florida. Maybe that's just the Everglades. So, all right. So, Susan, are you okay with us getting into some of the pathology specimens?
Yeah, we're going to explain.
All right.
That we're going to flash a picture up.
Yes.
And if you're squeamish or you have kids around or something, you don't want to expose until you know what it is.
Right.
We'll flash it up. If you want to take a picture of it and play along, you can guess what it is. It's called mystery diagnosis.
And Nicole, for purposes of making sure that we're completely forthcoming with all this, these have been either consented or how do we come by these specimens, these pictures?
So the first case is a patient that she actually emailed me the day that we talked about doing this show. So I said that I would save this aside, and I told her that I would be using this, and she was cool with that.
This one's not too bad.
Can you give us some clinical on each of them before we flash it up?
Well, you have to guess.
No, I know. Is there some? I mean, I've been loaded on this one picture, and I've got a few things in my mind. Some clinical would.
This one's not too bad.
The second one is from a pathology website, and it's not necessarily from a specific patient. It's more of showing a specific disease process.
So I'm already there's a problem here. I know Nicole well enough that I know that there's going to be a Fordyce.
Well, make sure you let some of the viewers guess too first,
right,
and see what they can come up with. I'm sure we have a few medical people out there, but
I mean, a Fournier's gangrene. There's going to be a Fournier's gangrene in this batch. I know Nicole well enough to know that.
Drew, don't. That's a spoiler alert. Don't mess up.
Wait! I couldn't hear you. What's that, Nicole? Wait! She had a reaction. What's that?
If Susan's freaking out that bad, I thought that this was very tame.
Oh, well, here's what happened. I opened up my emails and they were in full res, huge size, and I was scrolling down and I was just going, oh God, I got to get to the bottom of this email. It was like full screen, but I'm particularly squeamish with these things, and I'm okay. I'm going to be okay.
Okay. So let's bring up the first. It's weird. See, as a pathologist, you're used to thinking about what you're looking at. I'm used to looking at the context, and thinking about what I've heard about what's going on before I start to build an impression. But let's do it your way. Ready?
We're going to show it, and then we're going to let you think about it, and then we're going to take a little break.
All right. Okay.
Yummy.
And there's a second photo for this one too.
Oh, Lord.
Please go ahead.
Okay, that's enough.
Okay, so
we're going to talk about it after the break.
Oh, you don't want to have a few up here before we go for a break?
I want people to think about it and come up with their ideas during the break.
All right, we'll take a little break. We're here with Nicole Angemi, the Duramatter.com, Duramatter, however you want to pronounce it, and also Mrs._Angemi on Instagram. If you like these pictures and want to see more, it's there. Be right back. Anyone who's watched me over the years knows that I'm obsessed with Hydralyte. In my opinion, the best oral rehydration product on the market. I literally use it every day. My family uses it. When I had COVID, I'm telling you, Hydralyte contributed to my recovery, kept me hydrated. Now, with things finally reopening back around the country, the potential exposure to the common cold is always around. And like always, Hydralyte has got your back. Hydralyte Plus Immunity, my new favorite, starts with their fast-absorbing electrolytes and adds a host of great ingredients. Plus, each single serving easy pour drink mix contains 1,000 milligrams of vitamin C, 300 milligrams of elderberry extract. Hydralyte Plus Immunity comes in convenient, easy to pour sticks that rapidly dissolve in water, make a great tasting drink, has 75% less sugar than your typical sports drink. Uses all natural flavors, gluten-free, dairy-free, caffeine-free, non-GMO, and even vegan. Hydralyte Plus Immunity is also now available in ready-to-drink bottles at the Walmart next to the pharmacy. Or as always, you can find it by visiting hydralyte.com/Dr. Drew. Again, that is hydralyte.com/DRDREW. Be sure to use the code Dr. Drew 25 for a special discount. You've heard me talk many times about my struggles with gut health and how I've been taking a probiotic from Seed. Well, digestive issues aren't just for grown-ups. Kids can suffer from it as well. That is why I wanted to pass along a clinical trial participation opportunity in the event that you may have or know of children who experience occasional constipation. Seed is currently recruiting 300 to 500 participants for a clinical trial to study the pediatric gut microbiome and assess their pediatric daily symbiotic, a probiotic and prebiotic formulated with strains that are intended to alleviate gastrointestinal discomfort. Participants will be compensated up to $225. Here's some details about this double-blind study. Children with constipation between the ages of 3 and 17 are eligible to participate. The study duration is 16 weeks. The study is fully remote with no in-person visits. Subjects will provide stool samples at baseline and week 12. Parents or direct relative guardians of study subjects will receive extensive education on the symbiotic use. If you'd like to learn more and or enroll, please go to drdrew.com/trial. That is drdrew.com/TRIAL. On behalf of my friends at Seed, thank you for moving science forward. I am so grateful for our friends at Blue Microphones. Not only have they completely changed what our show sounds like, they've given me headphones so I can monitor things better. This is the mic for millions of creative people, and now I know why. I'm so grateful for them completely changing the quality of our audio. You'll find Blue mics like Yeti and the Mouse, which we're using here, both in pro studios and home studios, literally all over the world. Their popular Yeti caster is a Blue Yeti microphone, plus a boom arm system that's behind many of your favorite podcasts. I run into them all the time, and now I know why. If you've ever thought about creating your own podcast or YouTube channel, Blue can make you sound and look great. Just visit bluemic.com and click Get Started, and you can start telling your story. All right, so we're back with Nicole and Angemi, and you've seen the picture. And while those promotions were playing, lots of good guesses on the mystery diagnosis, Nicole. Let me give you some of the guesses, and let me tell you my thinking. And I'm, of course, mystified as always by your pictures. Psoriasis was mentioned. Eczema and or other allergic was mentioned. And somebody mentioned shingles. And there were lots of...
scabies.
Well, interesting. Did you see scabies on the list?
Anna Strange, yeah.
Well, scabies was on my list, but
and then also a chemical burn, and then also shingles. You said that though.
Well, but shingles would have to be something called disseminated shingles, and that doesn't really look like that. Shingles is a single dermatome. Psoriasis has plaques, and I don't see plaques in this case. What I see is crusting, pustular.
You can show it again.
Diffuse. Non-symmetrical, right here it is. It's diffuse. It's not symmetrical.
What's impetigo?
Impetigo, I don't know. That's localized strep. I mean, it does have some of that appearance. The fact that it's the back of the head, the hair is missing, suggests either it's chronic or she's scratching a lot, right?
Why is her head all weird like that? They have to cut her open? Or?
And there's an awful lot of see the oily scales.
Okay, take a picture.
Actually, oily scales
I think I have a third photo.
Goes along with
take a
eczema.
Screenshot of it if you want to analyze it.
Oh, that was her before? So that looks more like Stevens Johnson's to me. That's like a diffuse injury.
Tom Cigar, just soak it up with sponge cake.
So Nicole, what are you saying?
Wait, we didn't.
Wait. We couldn't. What you block? Your sound blocks out once in a while. Say it again.
Oh, I said these are all good guesses. Do you want me to give you some history?
Yeah.
Or you still want to guess?
No, because I'm going towards it could be like a medication reaction, like a severe seborrheiform medication reaction, and it could be aftermath of like a Stevens-Johnson type picture, although it doesn't really look like that. Go ahead.
Somebody said prurigo nodularis.
Prurigo nodularis.
Okay, thanks.
Okay.
What is that?
It just sounds like.
Let me give you some history.
Okay, let's hear her history.
All right. Okay. So she's 24 and she has no history. Okay. So that's
right. She was fine.
But I'll tell you what happened before she got diagnosed, and then maybe this will give you a little bit of a clue. So she had a blister on her forehead. She's just 24-year-old, healthy, normal girl. So she gets a blister on her forehead, and she says like, "Oh, that's weird. Let me pop this." And she did, and then it came back a little bit bigger, and she did that 2 or 3 times. And she didn't really think anything of it. She didn't know what she thought it was, but she just kind of blew it off. And then she got 2 more of them on her back, popped them a couple times, and her shirt like started sticking to it after they were popped. And then she was like, something's up. Let me go to the doctor and see what's going on.
Did she get sick?
No, she wasn't sick at all.
Never. At no point did she get toxic or anything, right?
No.
Okay.
So she went to the doctor, and like her family doctor, who diagnosed her with shingles, and that's probably more common. That's why she got diagnosed with that. So it's clearly okay.
Yeah.
So 6 months went by, and she was it just seemed to be like increasingly getting worse. And then the doctor was finally like, "I think you need to go see a dermatologist. I don't know what this is."
Yeah.
The girl goes to the dermatologist, and she gets a biopsy, and the biopsy shows absolutely nothing.
Wow.
So then the doctor, So the dermatologist calls her back and says, "You know what? Like, I've been talking to some people and I've been reading some stuff, and I think that I need to examine the blisters when they're intact." Because she would, the girl kept she would pop them when they came up.
Now I'm starting to think of. You made me start first when you said the way it came out. I thought, oh my God, it's going to be smallpox, but no, because she didn't get sick. Now I'm starting to think about pemphigoid. Pemphigus is and she's alive, so it's not pemphigus. So I think more pemphigoid. Anyway, that's where my head's at now. Keep going.
Okay, so she goes to the dermatologist with the blister still intact, and after they examined her, rebiopsied her, and everything, she was diagnosed with pemphigus.
Pemphigus, I got it. Woo! Pemphigus vulgaris. Now, Now let me kind of zero in up. My understanding was I've only seen a few cases of this. Susan can't stand the pictures. Pemphigus, I thought was pretty much can be fatal. Pemphigoid is the one that's just horrible, and you can treat it with steroids and things. Go ahead.
So this is pemphigus vulgaris, and it's pretty horrible, but they were able to get it under control. So these photos of her that you're seeing are actually from 6 years ago. So she's been in remission for 6 years, and her skin's damaged. It looks kind of bad right now because she was on so many. Well, let me finish telling you what happened to her after, because this is not the worst part that I've told you so far.
Okay.
So she went to the dermatologist, and they put her on they just put her on a round of steroids for a week, right?
Yeah.
And it go away a little tiny bit, and then all of a sudden, when she was done the steroids, it went completely crazy.
Yeah.
Like, she got it inside her mouth, inside her genitals, under her breasts, like everywhere. It was crazy. So she went to a major university hospital, and they were, kind of considering putting her in a clinical trial, but they wanted somebody that was closer to being in remission. So they denied her for that. And she got so bad over the course of next couple weeks that her mother brought her back to the hospital in a sheet only, like completely naked. And she was crying so bad and was just like, please do something. And then they admitted her to the hospital, and she was put on steroids, chemotherapy, immunosuppressants, like crazy IV treatments. So that's why, even though her skin healed up, it looks she has like really bad stretch marks now, and she has scars and everything.
That's from the steroids. The steroids got the stretch mark, yeah. Well, is she on like Humira or something like that now? Is she on that kind of remittive agent, or what did they put her on, cytotoxic? Sometimes they used to use Cytoxan back in the day.
Yeah, she's on I forget what it's called, cell something, but it's actually used for kidney rejection and stuff.
Yeah, it's stuff. It's because this is an autoimmune attack on the basement membrane, and so the skin just lifts up, and that's the end of it. And the classic sign in pemphigus is something called the Nikolsky sign. You ever heard of the Nikolsky sign?
No.
You can take the blisters and slide them up the skin a little bit because the basement membrane.
Dermatologist was doing to her.
He was sliding the blisters around. Yeah, and so because the basement membrane is under attack all over the place, and so even beyond where the blister is, it'll just keep sliding up. So Nikolsky's sign, that's called, if I remember right. Fantastic. That's a good case. Nice. I love it. Everyone seems very engaged with that one. It's funny that, back in the day when we treated pemphigoid, all we had was steroids. But now you have the medications that are routinely, for pemphigus particularly, and by the way, the mouth, the eyes, the genitalia, and all that, that's the pemphigus syndrome. It's all epithelial, wherever there's a lining, it gets involved in this. And there's so much good remittive agents now on the rheumatology side. There's a lot to be done, and on the organ transplant side. So I'm not surprised that they were able to do something here.
She went through hell. Like, she was saying she couldn't sleep for nights in a row because she thought that she was scared to death to fall asleep because she woke up with her sheets like stuck to her body, and she had to like tear. Well,
it's like a terrible burn, right? It's like a bad burn. It's like it's almost like it's do you know toxic epidermal necrolysis? You familiar with that? Yeah,
you get Johnson's and stuff. It's horrible.
It's like a burn.
It's so horrible.
It's like a burn.
So one of the restreamers wants to know how she got it.
We don't know. That's the thing about pemphigus and pemphigoid. They think pemphigoid, maybe you have a theory, Nicole, in my day, that they would think maybe an allergic reaction to something, but we really don't know. Pemphigus was just one of those things. Is there anything new on that?
It's an autoimmune disease, so it's when your immune system kind of like attacks your own body. So it's really unknown. No one in her family has it. She's actually pretty young to even be coming out with these kind of lesions, because usually it's in older people, but she was under a lot of emotional stress, which is why her doctors think it came out. Her doctor also said it's one of the worst cases he's ever seen. You know what I mean?
I've never seen it under the age of 50. It seems like it's a 50 to 70-year-old kind of thing, typically, in my experience.
Yeah, exactly.
Weird.
Yeah. You never heard of pemphigus?
No.
Never heard of pemphigus. Caleb, pemphigus?
No. None of our kids got
never
it.
heard of it.
So
None of our kids got it. Therefore, we never heard
Thank
of it.
God. I'm surprised Douglas didn't get it.
All right, let's keep going. What do we got next? Mystery diagnosis number 2. All right. So you're not even going to tell me what organ that is, are you?
I'm not looking.
Because I always have a hard time between telling sick livers from sick lungs.
Yeah,
it looks like a lung to me, I hope. Either that or it's a weirdly cirrhotic liver. Is there any way I can, I have to walk up to the, can you tell me what's in sort of the proximal part of the, is that bronchi in the proximal part, or is that, I can't see it from here. That's the problem. All right, I'm going to make a guess. That is, it's kind of how I imagine COVID lungs might look like, ARDS lungs.
Ding, ding, ding.
I got it. Woo!
Wait, you're supposed to let people guess.
Oh, well, I was the one guessing. Look.
Yeah, let the audience.
Well, the audience was just saying lungs, so they got it right.
Somebody said lungs. Somebody said dissected.
But this is what happens. This is not necessarily a COVID lung.
liver.
But this is what happens with alveolar filling, inflammatory alveolar filling. This is kind of what it looks like. Go ahead, Nicole.
Yeah, well, there's 2 of them, so it's kind of a giveaway, right? The lung.
Oh, isn't that a sectional thing? I don't know. Anyway, go ahead, Nicole. You tell me.
So I got this. This is the case that I got from Pathology Outline. Do you know about Pathology Outlines?
No.
It's a good website for anybody that studies any field of medicine. It's just kind of like an online pathology textbook, basically. There's lots of doctors that donate gross photos, microscopic photos, and then they go through, you know, everything from like how it's diagnosed to how it looks under the microscope, and it's good. So I thought that this would be a good case to show today, just because this is like such a hot topic and everybody knows about COVID.
Yeah.
So like you were saying earlier, it doesn't matter if you showed these lungs, like they're not specific to COVID. So I've seen these lungs 100 times, from patients I've done autopsy on that had H1N1 to just people that have had other types of viral infections. This is clinically what you would call ARDS, or acute respiratory distress syndrome. But in pathology, we call it DAD, or diffuse alveolar damage. So that's what you're looking at. And that sounds like a lot of crazy words, but basically what happens with a COVID infection. So we all know about coronavirus, right? Mm-hmm. We've all heard about that, but basically the coronaviruses are given their names because they have spikes on the outer surface. And the coronavirus spikes look like a crown. So corona is Latin for crown. So that's where that comes from. And these little spikes in some people are like hooking up to cells within the alveoli or of the lung, like the lining of the lungs. And they cause damage that could cause severe inflammation. The airways can get thickened and filled with fluid, basically.
Yeah.
So that's what you're seeing in this gross photo. Like the normal lung, if you squeeze a lung, it feels like a sponge. It's like filled with air. And but in this case, if you look at this lung, it's like heavy, like it looks heavy. It doesn't, it looks congested, heavy. And that, you know, this is what kills certain people, you know, that have the reaction to COVID.
Yeah. So let's go through the differential of ARDS. There's sort of a basic differential, right? So it could be, like you said, diffuse viral pneumonia, or even just viral illness, number one. Number two, it could be a bacterial pneumonia, end up in ARDS sometimes. Shock of all causes, right? You can get ARDS from shock. Drownings get ARDS, right? True?
Yeah, I mean, they're
severe CHF sometimes, right? Congestive heart failure. Mm-hmm. What else can you think of?
Geez, I've seen it. Well, viral infections are the most common that I've seen it in practice. So, I think, like, I did an autopsy on a young girl, like 26 years old, with H1N1. Maybe was that 10 or 12 years ago or something?
2009.
Her lungs looked exactly like this. And then, interestingly enough, I did an autopsy in February with a patient that's lungs looked like this before COVID was kind of a thing. And now I'm wondering, like, that was before testing and stuff. And now I'm kind of like,
Yeah.
Because I remember taking them out and being like, man, this lady's lungs are jammed up. Like, you know, so, I mean, it's common. So that's what I want the takeaway to be, is that, like, what COVID is doing to people is basically nothing new that we haven't seen before.
Yeah. And if they live long enough to, say, get staged for a lung transplant or something like that, by the time they get to that point, the lungs are not only filled, they start to scar up too. The scarring kicks in if they go long enough. All right, what do you got next? I'm doing pretty good on this one. This is the best I've ever done with one of your tests. I feel pretty good about myself.
Yeah, well, let everybody else guess. There's going to be a leg.
Yeah,
so.
This is more Nicole-esque. This is a apple pie. Let me think. Gosh, I can't orient.
I have a second photo.
Okay. Oh boy, Nicole. Is this my Fournier's gangrene? Is this a testicle? What do we got here?
Wait,
hard.
Wait, hold on, Nicole. We can't hear you. Hold on. Don't speak yet. We got to let people guess.
Yeah, let them guess.
All right.
Okay.
Yeah, I had H1N1 too, and
like
that was.
it.
I don't put it back up there. Would you mind?
Stomach, lung, lamb shank, GI bleed.
I can't orient to it. Give me the other one.
Liver. People are just naming off every part of the body.
Yeah. I wish
Fatty
I could
liver,
figure
uterus.
out what I'm looking at there. Is there? Can you give me the scale at least, Nicole? Nicole, what kind of scale am I looking? Like what's what's the diameter of that thing I'm looking at?
Like a personal pan pizza.
Like a what?
A personal pan pizza.
Well, a pizza.
Placenta, somebody said.
Is that somebody that went through a buzzsaw and it's a hemisection of a human?
I can't even look at it.
I know how Nicole's brain works.
Professor Anthrax and he said I got the shivers. I know, me too.
Chupacabra, somebody's saying.
Chupacabra, what's that?
It's a man goat pig.
Oh.
So it's a devil goat.
Small intestine, heart.
What is chupacabra?
placenta.
How long have you lived in Southern California, Susan Pinskin? You don't know what chupacabra is.
I have no idea.
I'm really,
I'm getting
are
a lot
culturally
of,
insensitive.
I'm getting a lot of placenta, but also, and then a pancreatitis.
Yeah, I can't orient. Yeah, maybe placenta is good because that's about the size of a pizza.
Good.
But go ahead, Nicole. What do you got there?
And you can eat it.
Okay, so this is a placenta.
Yep.
Woo!
You guys-
Placenta wins. You get a coffee mug.
Fetus papyraceus. What is that now?
So placentas we get a lot of them in pathology. So we don't get every single one that gets delivered, every baby that gets delivered, because that would be ridiculous. But we get a lot. If there's a problem with the pregnancy, if there's a problem with the baby, all this stuff. So, okay, so in this picture right here, you see underneath of the text, there's kind of like a circular area that's a scar.
Yep.
Okay, that's the area.
That's the fetus. That's the fetus.
Let me give you the mom's history. So she was pregnant with twins, and one of the twins died when she was 8 weeks gestation. And then she went to term, 40 weeks with the other baby that was born healthy, alive.
Yep.
And the baby died kind of absorbed into the placenta.
And that's the other picture. Let's see that picture. That's the other picture.
So the next picture is that little scar cut open. So when we get that in pathology, we cut it open, and you could see it's a mummified fetus in the actual scar.
Yep. I see that. I can see some body parts and things. Terrible. Awful.
She was 8 weeks pregnant, but I think based on the limbs and everything, it's probably more like a 10-week fetus. But basically the baby died, so it just stops in time and it gets absorbed into the wall. And it's called fetus papyracea because it looks like parchment paper fetus kind of. And it doesn't affect the other baby that's growing in there. So the other baby was totally healthy and cool. And then this one is just, it kind of has like a gray macerated appearance, but it's because it's been dead in water for, 30 weeks or whatever.
Yeah. That's a good one. I like that one, Nicole. Well done. All right.
I like that. Those two.
Thank you for the sort of the what should we say, the size framing. There's not a lot of things that are the size of a pizza except placenta. So that was good. That helped me a lot. What's up next? Oh, that's it. Only 3. Oh, Nicole, I thought I'm used to you bringing out 6 or 7 of them.
Hey, I would have brought 20.
Oh, Susan. Oh.
You have something on your phone you can hold up and just
Well, we can go to the Instagram.
Do you really want to look at my phone? I have 70,000 photos on there of this kind of stuff.
Well, what we could do, if anybody wants to, we could tap into Clubhouse and take some calls, and or you can just, I don't know, you decide, Drew.
Well, let me go on her Instagram right now and see what's going on there and see where people send you a lot of stuff, right?
I mean, I can hold my phone up too.
I'm out on Instagram a little bit because I get in trouble too much, so I'm not posting as much on there anymore. But Yeah, people send me, I get so many emails every day that I go through. So I don't know if I told you that I'm writing a book about some of these cases. So it's cool because my followers like send me cases, and then I'm, you know, keeping them for the book. So it's going to be super cool.
Congratulations. That sounds awesome. Okay. You've got a, Susan. What's that, Susan?
Yeah.
No,
I think we'll skip that one.
I think I know what that is.
What can you?
I think I know what it is.
Can you bring it over here and I'll sort of identify it?
It says the sudden death of actor Dustin Diamond freaked out everyone who watched him growing up, and then it shows. I think it's his liver.
Oh well, there you go.
That is liver.
Well,
Nicole?
he had like a squamous cell carcinoma, didn't he?
It's small cell, actually. It's
Small
like
cell.
super crazy that he got that.
That's one of her posts. And then
crazy he didn't get it treated. That's just so awful, right?
Yeah, I don't really think there's much treating that. You know, I mean, he didn't go get it treated in a time because they were saying on the news that he had a lump in his neck, but I found someone sent me a video of him. I can forward it to you. He has a huge mass in his neck. It's very huge. So he already had mets when he presented, but I think even if you present early, which usually you don't with small cell, it's not treatable.
There's not a lot you can do. That's true.
Yeah.
I noticed on Instagram you have a cysticercosis, which is interesting to me because well, I'm sure you like this one. It's extra gross. But you can tell people what it is in a second. But it's so fascinating to me. We used to see a lot of it, and it was during the El Salvadorian Civil War. And there was a lot of it coming up from Central America at the time, and it was the leading cause of new onset seizure at the county hospital where I worked. And what's fascinating, and what's fascinating about the textbooks at the time, if you went in an infectious disease textbook, you know, they'd barely mention the syndrome, and in the neurology textbooks they'd say, you know, rare obscure causes of seizure. They'd put neurocystic psercosis, which we saw literally every day at that point.
Wow.
So tell people what it is.
So that is when you eat so it's not common in America, but if you're having patients that are coming, like you were saying, they were coming up from Central America, it happens when you eat pork, basically, that's infected. So
With?
It's a parasite.
Tapeworm.
And yeah, it's a tapeworm. So what happens is the pig is a pig is kind of eating around human feces. I mean, it's kind of gross, but this is what happens in countries that, you know, don't have really good sanitation of, you know, fecal material and things like that. The pigs can kind of eat around the same area in landfills and stuff where there's, you know, human feces, and then they eat the eggs of the tapeworm, and it's kind of like a life cycle thing. Then the people eat the pig, and if you don't, I mean, this is why you're supposed to, you know, cook your pig or your pork, you know. So what happens is you can get the parasitic infection, and then if it doesn't get treated, it can go into your brain and cause, I mean, it could really cause you to die if you don't get it treated, but it gives you seizures.
Yeah, and most people, when they think of pork-related parasites that you want to cook the meat well to prevent, they're thinking about trichinosis, right? Trichinella and that worm. But this is a very common one. It's called Tinea solium, and it's the eggs, it's the larva that gets into the brain and starts eating your brain, like forming a larva right there in the middle of your head. And you can have multiple cysts in your head too from the tapeworm parasite. It's the tapeworm larva. It's it's really a nasty illness. Quite treatable. And in my experience, surprisingly little damage. You know, once you get the cyst, if they're small enough to die, you can kind of deal with it without too much damage. So it's kind of interesting. You have another mystery diagnosis about poisoning. Is that urine we're looking at? Purple urine or blue urine?
Yes, that case is insane.
Tell us about it.
Do you want? So this patient has blue urine, and the reason that they have blue urine is because they drank porta potty cleaner.
Ew. Nice.
So,
of course they
and
did.
that was so. First, the story was that the wife bought a lot of porta potty cleaner and put it into soda bottles under the cabinet, and the guy drank it by accident. But then the story changed that the guy was an alcoholic and he drank it on purpose.
Oh, so boy.
He got really, really sick and had to, he went to the hospital, had to get, stomach pump, all that kind of stuff. And all his stomach contents were blue as well, but really, really, really sick. Soon after, within a half hour of drinking it.
Sounds, yeah. The alcoholics will do that. I'm looking at some hand pictures.
Don't leave any bottles of porta potty.
I'm wondering,
and who has porta potty solution under the counter in their house? Like, what? Huh?
I'm wondering if is that syphilis, like a strange case of syphilis with the hand lesions on your Instagram.
Which one is it? Can you show me?
How
Instagram, far back was it?
It was not that far back, like a few weeks, but it for some reason it won't let me sign in. Let me try it again. Let me start over.
You're talking about the photo of the hands?
Yeah, the two hands.
I'm going to see if I can get it.
All right. Here it comes. So it's just, it looks also allergic and looks like other things, but whenever I see bilateral hand lesions, I always think, and it's Nicole. Could it be syphilis? I'm wondering. Got to go a little obscure with you. Let me see if I can get it up here. Sorry, we're messing around with all this here. Mystery diagnosis. Oh, no, forget it. She calls it palmoplantar pustulosis.
Oh, nice. That's such a cute name. That could be a band name.
Was that allergic?
Say it
Nicole?
again. 3 times fast.
I don't remember what that one was.
Okay, sorry.
I'll have to look at the. I don't remember exactly what the cause. Oh, I do. I think I do remember though that it's like very common in smokers. Like 90% of the people that get it are smokers, right?
Oh, that's interesting. It's not something I'm familiar with. That's interesting. All right,
we're going to show it really quick.
Here it comes.
Caleb's working on it.
There they are. Does that look familiar?
Can you see like the one that has the I have the post that has the reveal on it. I believe that is a case that it's kind of like really, it happens in smokers.
Yeah.
90% of it.
Interesting.
Is like super.
That's from smoking?
Well, there are certain dermatological conditions that just occur in smokers, not really from smoking.
Oh.
It's related to smoking for sure. It's a palmar pustular, you call it. Oh, and the giant cell arteritis you have there. That's the other thing. What you're holding up something in the slide. What did you?
That's a temporal artery biopsy.
So talk about giant cell arteritis. Tell them about that.
So that's an inflammation of the arteries, and so the biopsy is from the temporal artery, which is up here. They take a little tiny piece of it, and it's a semi not super common specimen, but we've gotten them from time to time in pathology, and it's just easy to access that little vessel because they don't, if they want to get a piece of the artery, they're not going to, go in and cut out one of your major arteries to look at it under the microscope. So, again, it's
actually really important because I've seen an uncanny amount of temporal arteritis, giant cell arteritis. Typically, it's a diffuse illness. It's a polyinflammatory disease. It's really nasty and it causes blindness. And if you don't get on it early, people can lose their eyesight. And one of the hallmarks is, tender, visible, nodular temporal arteries here. And sometimes they're not tender, and sometimes you can't see them. But if you biopsy it, then Nicole will look at it under the microscope and see these giant cell arteritis, so-called, in the wall of the temporal artery. That's what it will be. Okay, I'm looking at people's.
All right, smarty pants.
Well, we're just talking. We're just talking a little shop. That's all. It actually.
I heard blah 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 blah.
Well, temporal arteritis. It hits older people. It's not uncommon. It responds to steroids. People end up on steroids for long periods of time, but then they get bone deterioration on top of their temporal arteritis. So you end up with this weird balance between trying to keep the inflammatory process under control. And it's associated with something called PMR, which is called polymyalgia rheumatica, which is like a diffuse pain in your muscles and bad pain in the muscles particularly, and joints. And the PMR is associated with a high SID rate, and that can progress to temporal arteritis sometimes. So there you go. Nicole, anything interesting you've seen in the last few days?
Yeah, I mean, I've been working on this book, so I have a lot of really good cases. Like all the cases that I'm using are not on Instagram or on my website or anything. So I have a bunch of really cool cases for that. So I don't know if I really want to tell you necessarily because I want the book.
I get it. You want to
make secret. But yeah, this week. So I have a website that I work on where I post like a lot of my pictures and stuff because I don't have to worry about social media deleting and censorship and everything like that. So this week and every week I write about like celebrity death or some kind of like a high profile death. So I wrote about sarcoidosis this week with Bernie Mac's death.
Oh, was he he was a sarcoid death?
Yeah. So, well, he had pneumonia, but his history of sarcoid, I think, in my opinion, contributed to his death.
Wow,
so,
that's crazy.
As he started before he died a foundation for sarcoidosis, just because it's kind of rare, and it's like his family still has it going, so it's pretty cool.
And it disproportionately, not exclusively, but disproportionately affects African descent, correct?
Yeah. So it's well, I think that Caucasian people and African American people kind of can get it equally, but like it's basically when Caucasian people get it, it's like not that bad most of the time. Yeah. And African American women seem to get it really the worst. And they can get like worse skin lesions and everything else. So this is like an interesting thing that I brought up in the Gross Room. That's the name of my website. Is that it's very important. Like I feel like in pathology and medicine, talking about like race is actually important. You know what I mean? Like it's important for reasons like this because we kind of categorize like diseases and based on people's symptoms, like how diseases are going to progress or not based upon, and sarcoid's like a perfect example of that. Race
and how you're going to respond to certain medications, race, ethnicity, and gender make a huge difference in medicine because these are biological genetic differences amongst the population. Guys like us, we have to judge what is likely to happen, prognosticate, pick the right treatments based on that genetic profile of that ethnicity or race. I mean, it is a very important piece of the story. So it's not something that we can somehow just stop doing. We'll harm people if we do.
Yeah, and I'm going to talk about that a lot in my book too, because I think it's the same thing like you were saying with sex too. Like you can't just not, you have to determine it just because things are just more likely to occur in men versus females. You know what I mean? So those things need to be talked about, and there's nothing like wrong with it. You have to categorize that way in order to treat people properly.
Yeah, these are biological phenomena. I misspoke. I should have said biological sex, not gender. That was my mistake. And gender is a separate topic. Well, Nicole, as always, it is really fun to talk to you, and I appreciate you coming in and challenging me. And I feel so good that I got 2 out of 3.
Let's
really.
do it again soon.
And good luck with the book. I still think
when your book comes out too.
I still think we ought to do some television somehow. It's been on my mind for how many years now, and I just think you have something really interesting to offer, and you never disappoint. And it's people need to know this. It's like life 101. It's just as you've always said, you have the same instinct that I have. You're like, this is the basis of human experience, which is our biological selves. And why don't we discuss this? Why don't we help people understand what this is?
Yeah, I don't understand, but I'm trying, like, I just think of other ways, like, how could you teach it? Because it's like, I can't even fully teach it on social media. You know, you're always going to be censored in some aspects. So it's hard to get the full picture out. Like, I can't cover any kind of pathology that includes a female breast, a vagina, a penis, like an ass. Like, it's just so ridiculous. Like, you know what I mean? And
those were some of your favorite go-tos for a long time on your Instagram.
Yeah,
What's
of
that?
course. I mean, they're like I do this thing that I answer questions every day on Instagram, and everybody asks about STDs, and like that's like the stuff people want to learn about. They're interested in, and and the thing is that the questions that people have that people don't understand it. They don't understand how they get STDs. They don't understand that you can get, you know, throat cancer from oral sex and things like that, because the sex education is horrible, like in most schools, you know. And if you don't have a mom or dad teaching you, it's like you kind of just grow up and you don't really know about this stuff, and you don't know that you can really get HPV if you're still wearing a condom and this and that, and people want it, and I can't even teach it because it's frowned upon because it's a penis or a vagina, you know. So
you're able to do it when they ask the questions, when you do Instagram Live every day or something?
I can do it when they ask a question, because all I do is write it in text, but I can't photos of anything.
And you highlighted many a foreign body in the rectum.
Oh yeah, that's like one of my favorite things.
because there's sort of no end. There's the Gross Room website. Because there's sort of no end to what people. It's the most astonishing thing. If you've ever worked in an emergency room, there's sort of no end with the foreign bodies. Like it's
not. You just get what I like, and it's always older men. Like, sorry, I think it's because they first we need to get rid of the stigma of prostate stimulation. Like, dudes love it, like just whatever, you know, and they get scared that they don't want to just go to a store and buy the proper kind of toy to use for that. You know what I mean? So they just the most random.
They're grabbing for whatever. Well, in the ER, when they came in the ER, they used to always say the same thing. We just go, "What happened?" It was always, "I sat on something. I sat on it."
It is like the stories are like hilarious, but my favorite one of all time that I always tell people is that I got like a half-eaten pear out of some guy's ass, and you know, I read the notes that came from the ER, because I don't see the patients when they come in, so, and I'm glad I don't, because I really don't know. I'm glad that I could kind of like examine stuff in the lab and I don't have to like make eye contact with people, and I just wouldn't be good with that stuff. But he said, you know, oh, my wife stuck it in there and like was eating it out of my ass. Like, at least he admitted to like how it got stuck. There was no like weird story that he fell on it or something.
It's just, well, the actual story is a little peculiar. It's not like there was no weird story. It's a little unusual, but whatever you're into, man, it's all good. Susan, any other questions for Nicole?
Yeah, I know.
What's that, Nicole? You're trying to say something.
I said people just get bored. I can't even imagine right now with all this quarantine. Probably really getting crazy with
the lockdown, the quarantine. Well, you may see an uptick in the volume of what's found there. So who knows? Susan, anything from your standpoint?
We had a lot of questions. Like, somebody wanted to know if you can get an STD, you can get throat cancer from oral sex.
Yes, you absolutely can. That's where that's coming from. It's if you get HPV, it's why you must get the HPV vaccine. That's why males must get the HPV vaccine in addition to females. Females are mostly understand that it's protecting them from cervical cancer, so most of them have been vaccinated. But for some reason, the males lag a little bit, and most enlightened physicians will vaccinate a male well into the third and fourth decade of life if he's out there out and about.
It's HPV, right?
It's HPV related, correct.
Yeah.
HPV in the male causes penis, anus, head and neck cancers. And the head and neck cancers are nothing you want to fool with. If you remember, Michael Douglas has that. And he specifically thought that's where it came from.
Wow.
That was his report on it. And I think that's correct. Other questions, Susan?
No, not really. I mean, it's been a pleasure though to hear her laugh and
Yeah, it's
about
good to
her
talk to
It's
Nicole.
so this is the members only, right? Site that I shared here on this.
The gross room?
Yeah, the gross room.
Is the gross room a membership site you have to pay to be in, Nicole?
Yeah.
Yeah.
It's because it's I put a lot more work into it, and I have to have someone run my website and everything like that. So it's like a lot. Because on Instagram I would only do a post that's 200 characters, but here when I write an article about a celebrity, it's so many words and so many pictures and videos, and
It's a brilliant idea.
That is the thing. One last thing I wanted to bring up with you. I am stunned how many celebrity autopsies were botched in the 60s, 70s, and 80s. I mean, really botched.
yeah. I mean, I like having access to the report. But that's my most favorite to just read. But for someone like Bernie Mac, for example, they probably didn't do an autopsy on him because they already knew that he, you know what I mean? Like he had pneumonia, and I don't know if they did, but I assume that they didn't. So there's no report that I could find. But I still like to write about people's pathology if I can't find the report. But I really love reading the reports, just seeing how things were done differently, throughout the years. Because reading even Beethoven's autopsy report is awesome. You know what I mean? They describe the bile duct being the size of a quail feather or something cool. It's really cool. How they the terminology changes and what certain people call certain things and everything. And then also, I just did Anna Nicole Smith's 2 weeks ago, and I noticed just simple things that they list all your tattoos. That's and she didn't have that many. She had 4 or 5. There's not that many. So you would list descriptively what each tattoo was, and then they didn't mention one of these huge tattoos that she got on her back right before she died. It wasn't in the report at all. And then when I see things like that, I'm when you miss I was always taught that in school, if you mess up one single thing in the report, then nobody is gonna trust you for the rest of the report because they're gonna think you missed other stuff. You know what I mean?
Well, I'll tell you what, I read her autopsy too, and what struck me dramatically was the woody degeneration of her gluteal muscles from all the opiate injecting. She died of an abscess inside that woody scarring. And she became septic from that. So she literally had an abscess in her ass that you couldn't feel because her entire ass had been replaced by scars from all the opiate injecting. Isn't that insane?
Yeah, it's insane, but you can say that with most of the, I talk about that a lot with the autopsies. It's when you're a celebrity, being a VIP in medicine is the worst thing for you because they break all the protocols, break all the rules. It's like Michael Jackson. You could just read all of them and just be all these people are dead because Elvis. You could just go on and on because of how they were, given too many medications. Whitney Houston. I just could make a huge list of all these celebrities that are taking entirely too many medications that a regular person would never get prescribed.
That's right. They manipulate the physicians. The physician is so excited to take care of this special person, and the special person is an addict and says, "You're the best doctor, and no one else would give this except you're my special doctor." And then the doctor realizes they're in trouble, tries to push out, "I'm going to destroy you. You're the worst doctor ever." This splitting behaviors that addicts get into. I had a fight with Namaguchi. Was that his name? The former LA coroner?
Yeah.
Yamaguchi?
He's done a bunch of them.
He botched them all. He botched them all. It was unbelievable to me. And I sat there with him, and he had the temerity to say that John Belushi was not an addict. That was not addiction. And I was like, oh, sir, you do not know what you're talking about. Oh, yeah, he was just messing around. Some girl injected him with a little too much that night. He'd never taken it before. I'm like, what are you talking about? This is somebody died of drug addiction, as all the other ones were that he claimed weren't addicts. Mama Cass, he botched that one. Remember he came out and said that she choked on a sandwich or something because they'd found a sandwich. It was a heroin overdose, straight up heroin overdose.
I think Natalie Wood too.
Natalie Wood botched that one. He just one after another. Did you see? What's that? Hold on, Nicole. What's that?
Marilyn Monroe's too.
Yes.
No.
And listen. I was watching a documentary on a flight the other day about Natalie Wood, and they showed her medication list. Holy crap! She was on barbiturates, hypnotics, and benzodiazepines. I mean, like big doses. And I was like, of course she drowned. It's amazing she could take a breath on all that medication, let alone swim. Oh my God. And he signed it off as nothing to see here. Nothing wrong.
Yeah, he's like the worst.
Yeah. I mean, it was just, and that's what bugs me about the Reels autopsy reviews by that guy. He doesn't take this on. He doesn't understand what he's looking at in terms of how badly those autopsies were botched.
Oh yeah, I keep that in mind. Like I like to just talk about things that I kind of think maybe, they were thinking, or things they left out, or things like certain maybe body parts that I would have examined, or just, you know what I mean? Like I like to try to call out things. If I don't see something that I think is right, then I think, I'll say something about it.
Somebody on the tweet is saying maybe he was trying to preserve their images, or he's just incompetent. Preserving somebody's image and distorting the report, your responsibility professionally, that's incompetent. That's incompetent. That's how these people get. That's how these people get these medication. Somebody goes, oh, we're not going to tell anybody. We'll just, okay, you're a special person. No, that's bullshit. You treat them just like everybody else.
Maybe they got paid off too.
It doesn't matter.
So, did you see Leopold's question? He said it a few times.
Vivisectionist. What is your opinion of vivisectionists as a sexual fetish?
I don't even know what that is.
I think it's somebody that like dissects animals and then has some weird sexual arousal from that.
I mean, what?
Yeah, I don't know what that is. I'm not familiar with that. Yeah. It sounds. Well, let's put it this way: there's no limit to what humans will get into. Just you can think of it, somebody's into it. So I'm sure it happens, but I don't know much about it.
I think that's like the one thing that I love about like the whole field of pathology. It's just like it's limitless like possibilities. You know what I mean? And now I get cases sent to me every day, and I still see shit, and I'm like, I can't believe that happened. I can't believe I'm seeing this. I can't, you know what I mean? Whether it's natural or it's, someone, an accident or anything, like you can't ever predict anything. There's always going to be something cool,
Yeah. Your fascination with accidents exceeds mine. And those seem like they're in other countries where those really crazy things happen, right?
Oh yeah, a lot of them. I have one doctor that sends me, he's from Pakistan and he works in a hospital there, and he sends me some crazy cases of and he sent me one the other day of a kid and this is stuff I would love to post on Instagram because I feel like it's like a public health thing almost. This kid, it was a group of little kids. They were outside and they were setting stuff on fire for fun because, that's what I was saying in the grocery room. I'm like, when I was a little kid, I wasn't into playing with fire, but my husband will say that he was, my little brother was like. You were not
a male.
Yeah, exactly. So it's not uncommon for boys to be outside and like setting things on fire because they think it's fun. This little kid fell in the fire somehow. The kids freaked out because they got scared that the kid fell in the fire and just left him there. And then he was eventually brought to the hospital with 90% burns on his body.
Terrible.
And what can you do for a kid at that point? But, it's a video. It's very powerful video showing like a 4-year-old kid burned up, and it's important for, like, maybe if you could just show one parent that and they sit down and have a talk with their kid or something and save something like that from happening. I mean, I know it's impossible, because I was talking about, like, I show my kids certain stuff. You know which pictures I show them all the time? The ones when, like, little kids are sticking sticks in their mouth and they poke a hole through their hard palate. I show my kids that all the time, you know? Say what?
She shows her kids pictures all the times of kids who are running around with a stick in their mouth, and it stick goes through their hard palate.
So when I was like 3, I was running down the hall with an arrow in it, and I fell on it and went down my throat.
Oh my
She
God.
Yeah, because
narrowly missed. That could have gone right to your brain.
My grandma was an archer, and we had bows
Could've
and
gone right to your
arrows
brain.
around the house. Yeah.
No problem.
I want to thank my mom for that.
Yeah, I show my kids that because it's just like kids do it. They always just, you know, they're walking around this and that. But, you know, my 6-year-old crossed the street without asking me the other day. And, like, I want to show her a picture of a person smeared across the street, because that's when you get hit by a car. Like, you know, it's just like, it's hard because people don't understand, like, what it looks like until you see it, you know?
Yeah.
And Nicole will happily share you lots of those. She shows loads of them, more than I've ever seen in real life. And I don't like stuff out in the field. It's too out of control for me. You know what I mean? I can take anything in once it gets to the hospital, but out in the field, it's like, oh, terrible. I can't even figure out what I'm looking at.
I mean, I say, like, my husband has to deal with, like, real life situations like that when the people are still alive, which to me seems absolutely horrible when people are screaming for their life and like that. But I feel like once they're dead, it's not that difficult to look at.
You guys are a perfect match.
I was just thinking that. That's exactly right. All right. Well, Nicole.
I've never met your husband. He's pretty hot, right?
He is. He's so great. You guys have to meet him, and he's more interesting than I am. Trust me.
I'm not sure that's possible, but maybe I'll give you as interesting.
I'm glad to hear that.
I wanted to try to pitch a reality show with your husband's firehouse, all the, you know, everything that goes on there with you, following you and him home. But I just think that'd be a really interesting thing.
I don't know if they would be down with that. They're, you know,
they probably wouldn't, but it'd be so interesting. But it'd be so.
Is, and
yeah.
He works with the greatest guy. Like, I love the guys that he works with, and it's, you know, when you're married to a firefighter, it's like it's not like coworkers. It's these people are, like, I have to trust them to handle his life. You know what I mean? So I love them in an extra special kind of way, because I know that they're gonna, like, save his life in a situation. You know what I mean? So we have, like, a tight-knit family with all these people, and it's definitely, like, super interesting, and they're all so funny, you know?
Yeah. Okay, Nicole, thank you so much. When can we expect the book to come out?
I don't know. That's up to me. It's a pain in the ass the way that I'm doing it, because I have to get, like, a lot of releases signed, because I'm using actual cases from patient, you know what I mean?
Yeah.
So, and it's logistically a nightmare. So that's what's holding me up. But hopefully by next year, I'm working with the publisher and everything. So I'm just not sticking great with the deadline. So
well, let us help you put that out there, and let's get together again soon, and we'll figure out some time when we're in the East.
Has Michelle Poe offered her editing skills? You know, she thinks she's the best at that.
She's pretty good.
She's the best at a lot.
All right, you guys, thank you so much.
It.
Again, it is theduramater.com. It's the Gross Room. It is Mrs._Angemi. And do you have a Twitter too?
No.
Okay, smart.
I tried today.
Smart.
But you can find her on Instagram. That's the fun place.
And anything coming up tomorrow, Susan?
Well, we were trying to book somebody. It's just going to be you tomorrow unless somebody pops out of the woodwork. So.
Oh, and those of you wondering about Dr. Zelenko, he's doing actually really pretty well. He's
home now. Did you talk to him?
I did talk to him, and
good.
He's moving along rapidly.
Oh my God, that man has a will.
He has a pulmonary artery sarcoma. Isn't that crazy?
Oh,
and
Mike.
yeah, I know. and is doing well with no Mets and is on, appropriate chemo and thing. But the chemo made him neutropenic, and then he got COVID, and then the COVID got a little intense, and he's only got one lung because they pulled that lung out.
What day is he on his COVID?
I think he's like 7 or 10, something like that. He's doing pretty well.
So
He got all the good stuff. What's that?
They resected that cancer?
I think he had I think they resected it from it was a primary and like a pulmonary artery or something, and they resected it from the lung, and then he ended up on the pulmonic valve, and they resected that too.
Jeez.
Isn't that crazy?
Oh, God.
Yeah. Or maybe it was one of the, maybe it was the intake, maybe it was I don't think it was mitral, I think it was pulmonic. So anyway, crazy, really wild.
He WhatsApps me and he said, he has like a group WhatsApp, and then he sent me a picture of Fauci talking about hydroxychloroquine after I said, oh, I hope you, bless you and may you have a speedy recovery. And he sent me that picture of Fauci and his quote. So I thought he was feeling better.
He seemed pretty strong when I talked to him.
He's the funniest
I
guy.
was more out of it, I think, than he at this stage
He
of
will
COVID.
not give up on that.
Have you seen any brain specimens from COVID, by the way? Anything?
No, I did hear. I was reading. I was doing a couple like CME credits and reading how they think that there could be like CNS involvement and stuff like that. So
let me assure you. There's just an article right now I could send you. Let me see if I've got it. Beyond reasonable doubt, COVID-19 brain health fallout is real and severe. This is in Internal Medicine Medscape, and they've found multiple things. They found monocytes infected with the virus. They found premature megakaryocytes in the arteries in the brain. They've seen arteritis in the brain, sort of microvascular damage. And they've seen some sort of direct tissue damage as well. So it's all kinds of stuff going on.
Wow, that's insane.
Who's crawling up behind you? I think there's a cat coming your way.
Oh, God.
The megakaryocyte thing, I can't quite figure out. I wonder if that was just something incidental. But the microvascular damage fits perfectly with, the not smelling and not tasting. And I have ringing in my ear still to this day. It felt like a head injury. That's what it felt like, and that kind of reminds me of sort of a diffuse microvascular kind of process.
Yeah. Since you had COVID, like how was it? You got pretty sick from it, or?
Oh yeah, I barely stayed out of the hospital. I'm sure I would have. I didn't even go for a chest X-ray because I was sure it would be ground glass, the usual appearance.
Yeah.
And the most striking thing was, and I took lots of medicine to stay out of the hospital, and they worked. The Decadron worked, bamlanivimab worked, and the relentlessness was intense. I had H1N1 too, and the toxicity of H1N1 was worse, but the relentlessness of this thing was weird. It was just constant, and the neurological stuff was also weird. I was really kind of out of it. I really wasn't at all myself for weeks, months. And it just felt like a head injury. That's what it really felt like.
And Susan didn't get it at all? Just you had it?
Of course she didn't get it. She's bionic.
I'm on progesterone. I'm O negative. I'm made of steel, but I might get it. You never know.
My son got it. One out of the household got it.
I got the vaccine, so I'm good.
And I'm getting Johnson & Johnson vaccine tomorrow. So we'll see. And I've been following my antibodies. In fact, I had another antibody draw today, something called an additive score, and my antibody has been staying up. So I really don't need the vaccine. It doesn't look like, but I'm taking it because we're trying to travel in a few months, and they're going to require it. So I thought I'll just get it now.
Yeah.
So who's my friend with the ears in the camera? In front of you.
This is my high maintenance cat, but she has polydactyly, which you might find cool.
Oh, interesting.
So cute.
So her name's Thumbkin because she has thumbs. We just call her Thumbs.
extra
Oh, no.
extra fingers. All right, Nicole, thanks again. And I'm going to wrap this.
I have a great idea for a guest tomorrow if this other one doesn't work out.
Okay. I'm all ears.
But we can also do it on Friday. But we have a popular vote for Anthony Brown on Twitch.
Oh, sure. That'd be great. That'd be good. Has he told his story on this stream?
He was on our show, but I think we need a redo.
Fair enough. We need to talk a little addiction and stuff too. It's time.
Yeah.
That's
maybe
a good
we
idea.
can do a clubhouse thing and talk to people and
all right.
whatever.
Good idea. All right, Nicole and Thumbs, we'll see you soon.
See ya, bye.
Bye-bye. Bye, everyone. We'll see you tomorrow.